Hey guys, it's Dr. Sarah and Alicia here today. Thank you for joining us. Today we are talking about a really challenging topic to discuss, but really important for people to understand because it's a huge buzzword these days, informed consent. So we want to talk a little bit about what is informed consent. What does that actually mean? And how does it apply to childbirth? Because it is very different in childbirth than it is in any other procedure. So we want to kind of go through what it is, how does it apply in childbirth, and we'll give you a couple of real life examples that we've actually encountered ourselves to help you understand a little bit more about informed consent and how we use that during pregnancy and childbirth. So if this is the type of content you like, if you're pregnant, if you're early postpartum, please subscribe to our YouTube channel. Check us out on Instagram at she.found.motherhood or check us out on our website, www.shefoundhealth.ca. So let's get to it.
So informed consent is probably something you've heard a lot about, but you might not understand exactly what it is. So we actually learn about this early on in medical school and start to practice it in everyday. So basically what it is it's a process that we use, whenever someone's undergoing a treatment or a medical procedure. And really, like Alicia pointed out to me earlier, it could be used, in any interaction, like when you're fixing your car, to make sure that you truly understand what is happening, what the options are, and what happened depending on what avenue you choose.
So there's 6 key components to informed consent. So the first piece of informed consent is understanding or getting the information around what the issue, the diagnosis, or the problem that needs to be dealt with. So this could be if you have an appendix that's bursted, appendicitis. What is appendicitis? What does that mean? What are the kind of consequences of that? Or if you have gestational diabetes and your sugars are out of whack, what does that mean? And how can that affect you or your baby? So that is the first key component, is learning about what is the process or the condition that's going on within your body or in your car that needs to be dealt with.
The second thing is understanding the recommended treatment or procedure. So for Alicia's example, like appendicitis, we would recommend surgery to get your appendix out. So understanding what the treatment is or the procedure is and what that would involve.
And another really important piece to that is our third thing is what are the risks and the benefits of that procedure. So for example, appendicitis. The benefit is we take the festering, disgusting, pus-filled appendix out of your body.
You did that just last night.
I did last night, which will then help you get better. Right? But there's also risks associated with any surgery, risks associated with wound infections or with bleeding or with damaging structures around the appendix that you don't mean to damage. So understanding what the procedure is or the treatment protocol, and what are the risks associated and what are the benefits of that. So if we take an example, for instance, from pregnancy. So if you've been pushing for hours and hours and hours and hours and hours, and despite your best efforts and all of the tricks up our sleeve, you haven't been able to push baby down. We would call that failure to progress. And one of the procedures that we would maybe recommend is a cesarean section if we've tried everything else. And so then you need to understand, well, what is the issue? What is the procedure that we're recommending? And what are the risks and benefits of that? So the risks of a cesarean section, wound infection, bleeding, and damaging structures around. What are the benefits of a cesarean section? Well, you get your baby out pretty quickly, right? And so that is kind of one of those discussions. What are the risks and benefits of the procedure that they're recommending?
The next thing we want you to understand is what might happen if the procedure is not done. So in the case of appendicitis, if we don't take an appendix out, it can rupture and make you very sick and you could die, right? Ultimately. So in a similar, the example of dystocia or failure to progress, same thing. If we cannot get that baby born vaginally, then ultimately we could have a maternal and a fetal death. We're not saying imminently, but that possibly is one of the outcomes. So understanding that if you don't do the intervention recommended, what could the possible outcome be?
Now, the other thing is, what are the other treatments or procedures that might be possible in that situation? And what are the risks and benefits of that? So if we take the appendicitis, well, there is some new evidence coming out that if we treat you with high-dose antibiotics, that you might actually resolve the infection, especially in kids who are very well monitored at home, who who have parents who will kind of access medical help if they need it and get them right back to a hospital if things get worse. So that's one of the alternates. So you could have surgery, or if you would rather, because you're concerned with the risks of surgery, let's try some IV antibiotics for 48 to 72 hours and see if you get better. And if you do, great. And if you don't, well, we can go back to plan number one. So in the case of dystocia or failure to progress, we could try pushing for another hour or two. If baby's heart rate's okay and you've still got some oomph left in you, maybe if we try pushing for another hour or two, you can get baby low enough that we can help it out with a vacuum or forceps delivery. Or maybe you're able to push it out on your own. So that would be another option. And so part of informed consent is, what is our recommended treatment, but what are some other options that there might be out there? Sometimes there aren't any options, but sometimes there are. And what are the risks and benefits of the other option?
And then, you know, to bring it all home, basically what we want to make sure is that you understand everything. So oftentimes, if we have the time, we'll ask people to explain in their own words what is going on. What is the treatment we've recommended? What are the risks of that? What might happen if we don't do that intervention? And what other options could be available to them? And if you're able to say that back to us, then we know you absolutely understand the conversation we just had.
Yeah. And so then whatever your decision is, we know that you understand the risks and benefits of doing something or not doing it. And if you decide on a different treatment course, that is 100% your decision. You are in charge of your own health. And while you're still pregnant, the health of your babies. And so in pregnancy, that is kind of a discussion that we have. Now, childbirth is a challenging time to do informed consent. If you know Dr. Sarah and I, we are huge proponents of high quality, comprehensive, evidence-based childbirth education, learning about these things before you get into the situation, which we recognize for some parents to be, it's pretty scary thinking about all of the kind of possibilities, but it actually allows you to have a better understanding of what possibilities are out there, what the risks are of doing things and not doing things. So you've had those discussions and had those thoughts before going into the experience. If things go perfectly smoothly, amazing. But if you come up with something, at least you've heard about it before. You kind of have a bit of a basic understanding of what that could mean for you and or your baby. So one of the big things with childbirth is it is really hard when you're having active labor pains every 3 minutes to have a good informed consent discussion. One, you can't focus on anything we're saying during your contraction or leading up to it or recovering from it. And it's hard for us to have those conversations with you as well. So we actually don't, a lot of people don't believe that you can have a truly informed discussion when a woman is in active labor, having those active labor pains. And a lot of the decisions we need to make are during that time, whether you want an epidural, whether we need to help your baby out for some reason, whether you want to have a discussion about morphine or fentanyl or pain management. It all is happening when you're in pain on a regular, consistent basis. So it's really hard to have those like really comprehensive discussions in the moment. But unfortunately, that's what we have to do a lot of the time.
And I think the important thing to know is that if you can see how we just described the complexity of informed consent, when, you know, we're trying to rush to make a decision, especially, you know, when we're talking about fetal distress, a low heart rate, you know, moms can be sick. We just don't always have the time to have that conversation. And, you know, sometimes, and it is acceptable to, you know, sort of assume consent is informed when there's a life-threatening ailment present, you know, so severe preeclampsia,
or to have your partner's consent too. And so, and that can be a bit of a challenge. The other really challenging piece that we often come up with is we're actually have two patients in labor and delivery. We have the pregnant person and we have the baby who is not yet born yet or newly born. And sometimes the interests of one conflict with the interests of the other. And what I mean by that is, so let's take an example that we were talking about earlier. Not us. So this is a mom who's term and has been pushing, and baby's heart rate is dropping to a point that we actually feel like we need to get baby out in the next 5 to 10 minutes, or there might be devastating effects on baby's brain. And frankly, this is not that uncommon of a situation that we're faced with. And so the discussion is, okay, so baby needs to be born urgently. We can do that via vacuum or forceps or cesarean section, depending on the situation. But mom is actually doing okay. mom doesn't want forceps because there's a better chance of vaginal tearing, or doesn't want a cesarean section. That was not her prime choice. And so then we're having a discussion around the risks and benefits to both mom and to baby in an urgent situation where those things are not having the same goal, right? And the vast majority of time, moms obviously put their babies in priority and make the decision that is going to save their baby and save their baby's brain. But sometimes it's a really hard one sometimes to struggle with when you're in the thick of it and everything's so intense. And so really having those thoughts and discussions before even going into the labor process is really important.
Yeah. And that's why we are big proponents of, a birth plan, or really thinking through your birth preferences. And we've actually put together a template because in our document, the way we word it is not, I do or I don't want this. Because oftentimes in labor, things are outside of our control. I had forceps with my second. I would never say I want forceps, but I wanted the best outcome for him, and that's what we chose, and it was all fine. But, so in our document, we say, I would accept an epidural when, and then you can fill in the blank, when I'm completely exhausted, when, I can no longer tolerate the pain. I would accept a cesarean section when, and thinking about when you would accept these interventions. So like Alicia said, when you go into that birth experience, if things don't necessarily go the way you planned, then at least you've had those thoughts and had those conversations with your partner. Your partner is such an important person involved in this process as well. And it's really hard for the partners, right? So if you've had these conversations with your partners, then they know what you want in that time as well, if you're not able to articulate yourself.
And so another thing that Sarah kind of alluded to before is assumed consent for certain procedures. So certain procedures like a vacuum delivery or a forceps delivery, sometimes we need to do an episiotomy because we're expediting things. And so your perineum hasn't had time to stretch, which it normally would if you've been pushing and baby's head has been on your perineum. And so it can be quite hard to get baby out in an urgent fashion without performing an episiotomy. But sometimes we hear from women that nobody told them they were going to have an episiotomy. Nobody asked them. And certainly that's an important piece of it. But sometimes by agreeing to an operative vaginal delivery, that we consider a piece of that operative vaginal delivery. We don't cut an episiotomy unless we feel like either you're going to have a bad tear that is going to heal way worse than an episiotomy, or your baby needs to come out stat, like very quickly. And those are the reasons we don't do it generally for everybody. And if we have time to ask consent and we've got the time to let your perineum stretch, we're going to do that. But sometimes there is an implied consent given a bigger piece of the puzzle. And so that is something that I think a lot of women struggle with, not having been asked about an episiotomy, but they've agreed to the operative vaginal delivery to get their baby out quickly. And that is a piece of that puzzle. And so that can be a really challenging one.
Another example would be postpartum hemorrhage. So it's normal to lose blood, and kind of a lot of blood when you have a delivery, vaginal and more so cesarean. But we have to be really cautious in monitoring that blood loss, as women can lose a significant blood volume and become really sick really quickly. And so oftentimes we may have to give a medication, that we don't necessarily have the time to go through the informed consent process with. We'll absolutely tell you we're giving you the medication. Make sure you don't have any allergies. But, if we're talking, concern about needing surgery, or, ultimately some women end up losing their uterus from postpartum hemorrhage. It doesn't happen often, but it can happen if we aren't able to control it with medication. So we don't necessarily have the time to have those discussions. And that's why, in the prenatal course that Alicia and I put together, we talk about all these potential complications. We don't want to scare you at all. We just want you to be empowered and informed so that if you encounter shoulder dystocia, postpartum hemorrhage, if your baby needs resuscitation, you understand what is happening and what probably your care providers are doing to help you through this situation, that you have that information in your head before, and you can more easily accept the interventions or not,
or decline them,
totally,
with the knowledge of what that impact could be.
Yeah, absolutely.
And again, this is all about informed consent. It's just really hard in that moment. So if you go in prepared, you're going to have a much better experience regardless of what happens, because you're going to understand what's happening, and you're going to be able to make decisions that you and your partner and your baby are happy with in retrospect. So that's kind of the big pieces we wanted to talk about around informed consent, and why we are such pro advocates for really good, high quality, comprehensive education. So if you have any interest in doing an online prenatal course with us, it's at your own pace. You watch it when you want, how often you want. You can watch segments over and over and over again if you like. You can check it out on our website at www.shefoundhealth.ca, and we'll make sure we link it in the show notes below. So we hope that's helpful. We know that it can be a bit scary, and we don't want to think about the bad stuff that can happen at childbirth. And again, most things come out really well.
Totally.
But certainly we do want people to be informed and prepared going into childbirth, and understanding what informed consent truly is and why it can be a little bit of a challenge during the childbirth process.
Thanks for watching, everyone.
Have a great day.